Hello, welcome everybody. Thanks for being with us today. We are broadcasting live from Park City, Utah, somewhere in Connecticut where Allison is, and in Virginia where Mike is. Thank you for being with us today. We can't hear or see you, but we encourage you to ask questions in the chat box in the Q&A as usual. For the record, we're recording this, and if it's okay with you guys, we'll post it to the Family Office Insights YouTube channel. And then you can find it there if you want to review it, but we also encourage you to, if you find it interesting today and you think there are others in your world that might find it interesting, we encourage you to make sure you connect directly with Allison and Mike. And my point in all that is we're not Family Office Insights. It's not standing in the way. Make sure that if there are people interested that you connect directly with them, which also leads me to the folks that are on the call today. Will make sure you're in direct contact so you can pursue this as you wish. The webinar is about a half hour today, but feel free to ask questions throughout. We've got a bunch of folks coming on, so please post your questions as they come to mind so we can get to as many as we can. So with that, and by the way, this is all Allison's fault. We've known each other for a long time, and I'm so glad to share this with you today. And super, super grateful for Allison and Mike being with us today. So Allison, thank you for being. Take it away.
Arthur, thank you. Yes, and great to be here and great to be with you all. And thank you, Arthur, for all your support on this. I'm Allison Davis. I'm the interim CEO of 15toKnow. And I've got Mike Dershowitz, who is our founder, with us as well. In terms of my background, I am Goldman Sachs and JP Morgan trained, but have spent some time also building retail operations. And so when Mike came to me about this opportunity, I was just so excited, and we're really excited to share the story with you guys today. I wanted to take a second and let Mike, who is a serial entrepreneur, really understands how to build and scale companies. He's built several successful companies and has been a friend of mine even longer than Arthur. We're going on 25 years now. So, we're excited to be working together on this great opportunity. And I wanted to give Mike a couple minutes just to give a little bit of background on how 15toKnow came to be. And while he does that, I'm going to get the presentation up and then we can talk about where we're going from here.
Wonderful. Thank you, Allison. Mike Dershowitz here. Thank you, everybody, for being with us. As Allison said, I am a serial entrepreneur. If you ask me, I'll tell you I started my first business when I was in elementary school selling candy to my friends because I saw wage arbitration opportunity. But in reality, as I've matured in my career, 15toKnow is the 8th company that I've started. And I tend to be more of an operator, so I really do like operating companies. But obviously, as my companies have gotten bigger, the thought does turn towards what else can they become and how can they really move the market. In the case of 15toKnow, the original idea was brought to me by an infectious disease specialist, close friend of mine, in the suburbs of Philadelphia, in what's known as the Main Line, and he was very frustrated in the heart of the pandemic at the lack of testing. And in August of 2020, he came to me and he said, it's a little ridiculous that the one thing that the textbooks on infectious disease say is to get testing out there so that you know who's infected. And that way you could slow it down. For whatever reason, a bunch of missteps on the policy side, it took us really until September, took the economy in general until September to really get mass-produced tests in the hands of people and distributed. And luckily, this doctor had the connections needed to the suppliers to get the tests before anyone else did. But he didn't know how to build a business. And I know how to build a business, this business being my 8th. And so he came to me and said, this is something that the community needs. I want to help the community, but if it's a good opportunity, then that's great. And so on October 14th, 2020, we opened our doors for the first time. By the end of the year, we had 7 testing sites operating. And at our height in the middle of the pandemic, we were operating 22 testing centers in 3 states, though we're smaller now, and have tested over 500,000 people since the inception of the company. But it was clear in the middle of 2021, as the pandemic was going through its ebbs and flows, that healthcare and what patients were expecting from their healthcare was changing. And it was changing because the pandemic had made the concept of health information so much more important. Before the pandemic, you could wait 2 days for a test. You could wait that time to know if you were truly sick, but now in the middle of the pandemic, you couldn't, because human activity stopped unless you knew you were positive or negative for COVID. And that idea really stuck with me. And I knew even back in 2021 that this idea had broader application to our healthcare system in general and to the way people now need to live their lives. And so 15toKnow has been operating consistently since the start of the pandemic. And I will now turn it over to Allison, now that you understand the background, as to what we are currently doing and what is possible in the future with this very simple idea. Allison?
Yeah. So, I think as Mike said, it's probably not a surprise to anyone that there's really been a fundamental shift in the healthcare market, in industry in general, right? The consumers want more access to their healthcare data in real time. Doctors want real-time access to results so that they can treat better. The telemedicine industry is growing. And at 15toKnow, what we're really bringing to that is a solution that offers over 50 easy FDA-approved low complexity tests. They're called CLIA-waived on a drive-through basis, and really creating a national model where people can have that access, that efficiency, and get their results in less than 2 hours texted to their phone, which is something that we do not see anywhere else in the market. And we think we're really a front runner on that. As Mike went through, you've seen sort of the history of 15toKnow. I think the key pieces are at this point, we are transitioning to that brick and mortar setup. We brought in Dr. DeTrolio, who is an ER and urgent care medical director, who is extremely excited about this opportunity. And we're here today because we're raising what I'm calling a seed-like round. We have operations, we have revenue, but the seed-like round to help with this pivot and to help with the build out and getting this up and running and moving forward in the way that we envision.
Allison?
Yes.
If you don't mind, it was super instructive to me when we chatted earlier about what CLIA is. Yep. I think that helped me frame it out even more.
Yeah, of course. So, CLIA-waived basically are these tests that were created to be in doctors' offices, right? So they're small, low complexity. You don't need a medium or a high complexity lab in order to do them. They were created to be put in doctors' offices. And what I think a lot of the medical device companies have found is that doctors don't want people sitting in their offices waiting for test results. They want them in and out. That's how they make their money, is if they can move patients through their offices. They also don't really want sick people in their offices anymore because, they found that helps breed more sickness amongst their patients. And so what we're really doing is taking these FDA approved, consider them boxes or test kits, moving them to a centralized location so that people can get ready access to them, and in a way that's quick and efficient. Book your test, drive through, take your collection, get your results texted to you in 2 hours. So Arthur, does that help? Did I hit all the points there?
Super helpful. Thank you.
Awesome. So I think the key here is that look, from an investment highlights perspective, obviously we're really at the forefront of a market that is changing in a paradigm shift that I think we are in front of. We've got the highly replicable model. We know how to train people. We know how to put protocols and technology in place to quickly roll out these various tests. The brick and mortar strategy is going to take advantage of some former bank branches, which if you live anywhere in the suburbs, there are empty ones out there, and also our well-known brand name that is already established in the Pennsylvania market. And I'll talk a little bit about some of the consumer and doctor research that we've done here shortly. We've got multi-channels that we're going to go through in order to make sure we're bringing the right consumers through the model. And the financial model, expected payback per location of less than a year, and really strong financials in terms of the ability to drive the flow and the throughput that creates some great economies of scale as we get to multiple locations. Ooh. There we go. So I mentioned the multi-channel sales strategy. I'll actually work from right to left here. We talked about direct to consumer. I think that's pretty clear. We are also working with healthcare providers, doctors in the local market who have indicated an interest in having access to lab tests in this way. But we're also working with a national occupational health provider and are reaching out to others as people go from working in big offices where occupational health providers, have that sort of doctor's office in the bottom of the big office to more work from home. The occupational health outsourced providers for groups like Pepsi and P&G, they're trying to figure out how to work with that work from home strategy. And the one that we're talking to right now has been pretty clear that they see us as a key pillar to that. Because if somebody's not in the office, they can't just run downstairs to see a doctor, and they need to understand how to combine that with telehealth in a way that makes it easy for that employee to get access to that healthcare. As I mentioned, we did some research. We did some research with doctors who were very supportive of the concept. The fact that right now turnaround time for labs is 48 hours or more is a long time for them, and the ability to get results in less than 2 hours is key. And the majority of them have really had experience with patients paying upfront for lab tests. I may have missed mentioning in the beginning, all of our lab tests are cash pay. We do provide the ability for consumers to go back to insurance for reimbursement. But our entire setup is a self-pay setup. And when we talk to doctors, their wish list really coincides with what we have on a CLIA-waived basis. And, which there's a bunch of examples listed here. But I think the key being respiratory, glucose, cholesterol, STDs, metabolic blood panels, pregnancy, fertility, thyroid, and more. So, the doctors were very supportive, and, we've actually got a handful of doctors that are looking at this from a investment perspective as well.
Allison?
Yes.
I think it's commonly accepted that a COVID test is not it doesn't have to be prescribed. The other tests that you mentioned there, are they also ones that don't need to be prescribed?
Well, actually, a COVID test does need to be prescribed officially. And
Really?
so,
Wow.
yes, so we have
there you go.
So we have a medical director, Dr. DeTrolio, and that medical director is actually the prescribing physician for the labs as they are getting ordered. And so we have the protocols in place so that as somebody requests one, the order comes through from the doctor, and that is what gets used, to do the test.
So how does that work? I don't mean to take you off track here, but
No.
I want to get a cholesterol test or one of the other ones, glucose or STD. I send in a request to you folks. Doctor says, okay, that makes sense. And then they prescribe it.
Correct.
Super interesting.
In some cases, yeah. And there's a point here, right? In some cases, some doctors, depending on the test, are going to feel okay about just prescribing it. In some cases, they may want some patient interaction. It really depends on the test and and what is it for.
Yeah.
So that, and so the doctors are, and that's why sort of partnerships with telemedicine is an interesting two-way transaction for us. On one hand, they're virtual, and if they have patients in our footprints, then they need a place for their patients to get tested, just like any other doctor would. But there's also the reverse transaction, which is a patient comes to us and receives a positive result and may need some consultation. So when we kind of look at the opportunity, you never want to have just one market you can sell to, right, when you're trying to do something new. And so this opportunity is very interesting because it does, move through really a bunch of different channels. And I want to, because this is actually a great opportunity to respond to Charles's question, which I'm going to do. Charles, you're absolutely right. And you would think the same of any test that's available, OTC, which stands for over the counter at Walgreens or CVS. Why are people actually buying this stuff? We thought the same thing when we launched the company. The answer is very, very simple. Because we are a regulated industry and a regulated business that has to complete their tests against a certain protocol, and because we issue an official result, the consumer is willing to pay and then sometimes just for confirmatory testing, pay for either a pregnancy or a COVID test. So there's lots of people that take the home COVID test. They're positive. They're like, oh, I don't trust it, or maybe I did it wrong. Let me go to a lab that knows what they're doing and can give me a real result. And so that's where actually the power, in the market can be. Keep in mind, however, Charles, that a good amount of the tests that are actually listed that are CLIA-waived are not actually available OTC. Right. So a pregnancy test is a great one. But if you'll ask any woman who wants to be pregnant or doesn't want to be pregnant and is pregnant, the opportunity for them to buy a confirmatory test at a registered lab is something that we do think they're going to do. So
I
thank
think
you for the question.
And Dr. DiTrolio has some great points on this too, where somebody says, I took 3 pregnancy tests and they're all positive, but I'm coming in for a pregnancy test, right? Because he's got 30 years of emergency room and urgent care experience, and so we he's been a great addition to the team in terms of how we think about some of these, which, yes, it's surprising, but it is very, very true. So were there any other questions, Mike? I appreciate you looking at that.
I think we're good for now.
Okay. So I think I mentioned the doctor research. We also did consumer research, surveyed a little over 500 consumers in the broader Pennsylvania area. Over half were willing to self-pay for tests. And I think what was interesting, of those that initially said no, another quarter indicated that if the results were less than 2 hours away, that would make them more willing to self-pay. And another 35% would do it if their MD recommended. Not surprisingly, the 18 to 35 range was the range that were more willing to self-pay. I think as you get into some of the older cohorts, there's a little bit more resistance, but over 80% indicated an interest in a drive-through option, which is, the amount of excitement that we hear every time we talk with people about the drive-through experience and the ability to do these things on a drive-through basis has been great. And I think the most important for us was when we looked at those that were willing to self-pay for tests, almost 90% would use it to get their results before consulting with their doctor. And almost 100% would like their doctor to be able to order tests for them, or would ask their doctor to order tests for them at a lab like this. So really strong positives from the consumer research that we conducted earlier this year. So just to give people a sense, we've been extremely busy this year. We have launched strep, HIV, and syphilis testing at all of our sites. It's part of our product rollout, which I'll walk you through in a minute. I mentioned the occupational health partnership that we're working on with a big national occupational health group. We brought on Dr. DiTrolio. We also brought on a director of consumer marketing who's been great and really helped getting the reach and engagement out there for us, as well as running some additional couponing and things like that to help get people learning about the new tests that we're rolling out. And we've got LOIs out on 3 properties in the Pennsylvania suburbs as we work to continue the brick and mortar process and get those sites up and running, where we'll be able to roll out even more tests, some with venipuncture, some with urine samples that are a little more difficult to do in the tent and trailer model that we have so far. I mentioned Dr. Bobby. We've mentioned him a couple of times, so I'll run through this, but really over 30 years of medical experience, and has just been a great addition to the team and really understands all of the tests that we're looking to roll out. And wanted to then step into the product roadmap. I mentioned, that we've launched a couple of new tests at this point. This gives you a better sense for all of the CLIA-waived tests that are out there, how we're looking at rolling those out, both in terms of, some of these are what we call cassette tests, where it's, a little cassette. If you've done your own COVID at-home test, you know what a cassette test is. Some of these need machines that to run the tests, and others are things like dipsticks or things like that when it comes to urinalysis. So there's a variety of different ways that these tests can be run. And this is our setup. We expect by the end of the year to have the majority, more than a majority, almost all of the CLIA-waived tests that are out there available through 15toKnow at all of our locations.
Since you're on the subject,
Yeah.
Mike, you want to share your question and answer that you just put into the Q&A?
Yeah, absolutely. So James asked, do you send the kit and patient samples to CLIA lab for the results? Is it your own lab or the labs you contract with? No, these are our own labs. We hold licensure from the Department of Health in the states that which we operate. And the machines and the patients are on one, and the staff is on one location, one site, currently tent and trailer models, soon to be brick and mortar. And that's kind of the point, is that when we have that level of control, you get a fast, accurate result that's easy, and you get it in under 2 hours. So that's, just to make that clear, it is our labs. We don't send it out. We are not a lead generator. We look at this as a piece of infrastructure that the healthcare system sorely needs.
Yeah, great.
Perfect. Thank you.
So I also wanted to spend some time giving people some comfort around our financial model and how we've thought about this. I think, because it is all self-pay, we recognize that one of the keys to success is having reasonable test prices. And so when we thought about pricing across the various tests that we're rolling out, we've looked at a minimum gross profit margin of about $40 per test. Some of these tests costs $5 or $6 for us to purchase. Some of these tests cost closer to $70 per test for us to purchase. And so there's really a wide range, but even at the $70 test, the majority of our tests are going to be well under $100 in terms of the retail price to consumers. To give people, sort of a point of comparison, we're currently selling our PCR and what we call our Cepheid multiplex test for $225. Just the Cepheid multiplex does, with one swab, it gives you COVID, flu A, flu B, and RSV. So one swab, 4 results, thus the higher price for that. And that's a PCR test as well. And so when we think about being able to price all tests at $100 or less, we think that this is, especially in the demographics that we're focused on, this is very reasonable, and that people will be very willing to pay this for both the convenience as well as the speed of results. With that in mind, we've looked at kind of what the 4-wall economics are at each of these brick and mortar sites. And obviously there's a range of rental and labor costs, but as we look at those, on a low basis in terms of rent and labor costs, the break even for those 4-wall costs on a monthly basis is 23 tests per day. At a more high rent and labor cost, it's 42 tests per day to break even. We're currently averaging about 40 tests per day. And this is in the summer when COVID isn't really out there all that much. We've got a couple of other tests that we're offering. We think it is very, very reasonable to expect that the sites will do well above these numbers in terms of number of tests per day. And in fact, the sites are going to have the capacity to do closer to 400 tests per day. So, we feel very good about that from a 4-wall economics, sort of model perspective. When we put the overhead on top of that, we've built the right team to really drive scale and profitability here. And so when we think about the overhead at about 160 per month, that's the technology, the website, the booking, because each site has the ability to book and pick your time. So you come in and you know that you're not going to be like waiting in line, customer service, marketing and advertising, and management salaries. And so again, using that minimum test per test profit, that's a little bit of a tongue twister, of $40 with you need another 133 tests per day across all sites. And so when we think about it with the 3 sites that we have right now, that's about another 45 tests per day at each location. But as you can see, the economies of scale are pretty strong. And when we get up to 6 sites, it's only another 20 tests per day that would need to be sold in order to cover that overhead and really drive the profitability that we're expecting. And so when we look at that on a combined basis, I think the key is over here on the right? For, with 3 stores, we need to be selling 77 tests a day per store to break even. Still highly reasonable given the fact that these stores are going to be able to do over 400 tests if necessary. But that comes down pretty dramatically once we hit 6 stores. And so, I think we feel very good about our ability to execute on that, especially as we have the full suite of CLIA-waived tests rolled out by the end of the year.
So what's the trending? Look at that. Probably we're going to go right into it. Aside from the complications with what time of year it is the testing dropping off for COVID? And then you hope to pick it up with the other stuff? Is there some sort of trend you can, that helps you
Yep.
be confident?
Yeah, I think even when we look back at 2021, this was a super slow time for COVID. And right now, I'll say we're averaging about 30 to 40 tests per site, depending on the site, per day. So we feel like that, especially in July and summer months, is like, that is baseline, right? And as people come back to school, as the fall picks up, I think, we do expect to see another uptick in COVID, but that's not really what we're relying on, right? We're relying on the rollout of the additional tests and the access to those additional things in terms of what's really driving our thought process on the model.
And it's a great question, Arthur. I mean, I also want to point out that, in 2020, we sold one test, right, which was just the COVID antigen test. In the beginning of 2021, additional COVID tests, like what's called molecular, which is a technology that's not as accurate as PCR, but then PCR in point of care was released. And so what we've actually seen is that the share of revenue coming from sort of the replications of what exists in the over-the-counter market that can be picked up at the pharmacies, that share of our revenue has actually declined, and the increasing pie of our revenue is actually in, these other COVID tests that are higher accuracy or multiplex or whatever. So it's an important trend, I think, because it's really previewing how we are currently pivoting the business, so that consumers have already begun to think of us as having multiple offerings for COVID. And now to kind of come forward and say, okay, we're going to be able to give you these other types of tests. So it seems to make the right path forward in terms of what consumers can get from us and what they expect to get from us.
Yeah, totally makes sense. Thank you.
And so when we pull this all together in terms of looking at 2023 and 2024, in 2022, we're expecting a little over 5 million in revenue. As I mentioned, as much as we're raising a seed round, we have revenue, and we're just below break even in terms of an operating income line. But you can see as we roll through 2023, get the brick and mortars rolled out, and then accelerate the pace at which we expect to roll them out, likely in conjunction with our occupational health partner. Looking at 2023 and 2024, the expectation is that by 2024, we'll be over 20 million in top line revenue, and really seeing some significant profit being thrown off from all of those locations that are running. And for anybody that wants to touch base later, I'm happy to walk through all of the detailed pieces that go into this model and our thought process. I think we've been relatively conservative with the projections, and currently are expecting that our tent and trailer sites will actually roll off as we roll into brick and mortar. I think if we see another COVID wave in the fall, there's an opportunity to keep them open for a couple more months and take advantage of that additional cash flow. But we've really tried to be rational about how that's going to work in terms of the consumer demand, and making sure that we're being thoughtful about the new brick and mortars we're putting up versus the tent and trailer sites that we have nearby. And like I said, I feel like we've built the team that's ready to do this, right? So I came in April. Dr. Bobby has been with us since May. Kathy started at the beginning of the year. She's got, she's really driving our provider sales and the strategy around that, and talking to doctors and helping them understand how they can order tests for their patients here and how they can use us. She has 15 years of provider sales experience from Genentech, and she's also a registered nurse practitioner. So brings a wealth of knowledge to us. You all have met Mike, but we've also got Jeff DeTrolio, who's our COO. He's really got a great ability to, assemble high performance teams, manage. He's a process engineer by background, and so is great at making sure that we've got the right protocols in place from a scalability perspective. And then Lexington Everett, who most recently comes to us from professional pharmacy, has a strong marketing background, but also with that healthcare bent to it, which is super important given, the regulations in this industry. And we want to make sure that we're being fully compliant with all of that. So, and then I see there's another question in the chat. I don't know.
I've got it.
You got it? Okay.
Yep.
Thanks, Mike. And so mentioned at the beginning, we're raising $1 million through a safe structure because it really is a seed-like round. We've recently converted from an LLC into a C Corp to be ready to accept this capital and drive the scale that we are looking for. I think that, to give people sort of the clarity on a sources and uses perspective, the safe for $1 million, we've also are in the process of securing a bank loan line of credit from a local bank for another $500,000. So we're looking at about $1.5 million in terms of total sources here, with about $250,000 going to each of the site build outs, some working capital and staffing needs. We are also building our own LIS system. We looked at a number of off-the-shelf options, and in order to do what we want to do and do it well, including having a provider portal where providers can go in directly and order labs for their patients directly with us, that's going to cost another $100,000. As I mentioned, some of the products require machines, so we wanted to put some capital in there for those machine purchases. Some are like the Gillette razor blade model where they give you the machine and you have to buy the pieces. Others are you buy the machine and then it's a slightly lower cost for the different sort of implementations and collections of the samples. And so that gives you a sense of, what we're looking at from a sources and uses perspective around this raise. And so for those that might not be as, and Arthur, correct me if I'm wrong, but some may not be as well-versed in the safe setup, the simple agreement for future equity. But this is the documentation used by Y Combinator for a number of their, or I guess most of their companies, where the investment comes in and officially will convert into the same form and terms as the Series A once that's completed. And we're expecting to raise that in early 2023 once we have a couple of sites up and running profitably. So we're capping the safe in terms of for the current investors on that Series A valuation at $10 million. And again, Arthur, correct me. Should I go through sort of the details?
I don't think you need to go through the
Okay.
safe. I think it's pretty common. Yeah,
Okay.
Y Combinator did us all a solid by putting that on their website, right?
They did indeed.
Yeah,
They
yeah.
did
Amen.
Yeah.
Are there other questions?
You want to
that have-
answer that one that you already answered, Mike?
Yeah, let me thanks. So Charles as well as, what's the overall mix of revenue right now? Sounds like it's currently driven mostly by COVID. How will the rollout change the mix? Yeah, I mean, absolutely, Charles. The majority of revenue right now is driven mostly by COVID. Again, it's not mostly just by, what can be bought at CVS or Walgreens. It is actually now the majority of our revenue now comes from sort of non-COVID antigen tests, which then is obviously COVID and some non-COVID tests. Right now we've got strep and a handful of other tests in the market, and we're starting to see our ones and twosies come in. And as part of our marketing and customer acquisition and provider strategies, the goal is obviously to get that number up, right? And so a lot of the sources and uses, when you look at the working cap, Allison, if you could go back to that, when you look at the working cap staffing, I mean, that's that's going right to getting the word out, getting the partnerships in place. That's going to drive sales. So that's really what that is. And you can see that once that kind of that's essentially what you're betting on. As I think about the debt that I'm signing for as a part of the sources and uses, that's what I'm betting on. I'm betting on that we can get people in the door to get their results in 2 hours instead of 48 hours from LabCorp and Quest. And we do view them as the competition. So if this is something that interests you, it's that's largely what you're betting on, is how can we get them in the door fast enough to build out and create something of value here. We obviously think we can.
Is the business being presently driven to the trailer and tents from drive-bys, or is there a campaign underway?
Well, we have, over 250,000 consumer emails in our database of people that have used us before. And so it's really a combination of, outreach to those consumers, outreach on social and things like that to make sure that people are aware of the additional tests that we're offering, making sure that we're sort of through word of mouth, letting people know as they come through for COVID tests of the additional tests that we're offering. As Mike said, we've had some onesies and twosies. I think what's interesting to me is that this new BA.5 variant presents with a very sore throat, and we've had multiple people come through for a COVID and a strep test at the same time, which, we think is going to be a huge driver actually come fall, but we'll see how that all plays out. And by that point, we will have additional tests available as well. And so it's really a combination of things. But that's I think that's.
And if I could just pop in here, Allison, I do want to point out too that, one of the things that this investment opportunity presents that others, sometimes don't is, 15toKnow. I mean, if any of you know people in the Philadelphia area, you should ask them if they've heard of 15toKnow. Because I do it all the time, and I usually 2 out of 3 have heard of us. And you are investing in a brand that exists in this marketplace and in Southern New Jersey and a little bit in Northern New Jersey and Northern Delaware. So the brand exists. It's just now a matter, so it's not like we're clean slate and people don't know who we are. It's just now a matter of getting that idea. Hey, you have all these other things and not just COVID in their heads. That I think makes this, an exciting opportunity and gives it, a lot of power. And so when we look at the history of the business, when you've tested over 500,000 people, in a DMA of about, I think it's about 5 million in the Philly region, you've touched, 1 out of every 10 people. So that's some pretty strong brand power that we bring to bear here, and we are seeing it convert. That being said, a good portion of people getting tested today are still new customers and have never been to our website. So there is still very, very strong word of mouth and good traffic, in all the digital channels for what we're doing.
Yeah, totally makes sense. So you talked about LabQuest, or what are the
LabCorp and Quest?
Yeah,
the duopoly.
The oligopoly, yes.
Yeah, it's really a duopoly.
Dyslexia kicked in. Is there meaningful competition that's doing it the way you're doing it?
There is not really. And I think the best anecdote I can give you is that, one, as a duopoly, I think they feel pretty solid in their places and don't see any reason to change up how they're doing things, to the extent that one of the partnerships we were talking to said they'd actually asked LabCorp or Quest, I can't remember which one it was, to do something along these lines, and they were told no, and they're a pretty big national firm. So we feel pretty confident that they're, sort of set in their ways, and that this is something that they're not looking at, and we're going to disrupt their industry, and then they're going to look back and wonder why they didn't.
Yeah, or hopefully just come and write a big check, right?
Which fine outcome.
Let's just put that out there too.
Yeah. That seems like a natural potential outcome for sure. Yeah.
We think so. I mean, a lot of it's going to be, how much they start hearing about how we're peeling volume away, through the provider channel, and also, how big we end up getting. So, I think one thing we have to research is, where are LabCorp and Quest headquarters, and how do we build locations near their headquarters, at some point in the medium term, so that they can kind of see the impact and really start to wonder. So, we're already thinking about ways such as that and where this thing goes.
Yeah, I totally get the sort of institutional quality testing. It's not the right way to put it, but credible testing results from an organization like yours. And how does this, because I've not done it, but I was in New York City, for a couple of weeks. And, there's a van with a tent in front of it, says free COVID testing, right? Is that just because they figure out how to get reimbursed and you wait 3 days to get the results? Is that how that works?
There's a number. Yeah. Go ahead.
No, I was going to say, Arthur, I was in New York a couple of months ago, and yes, I saw a different van and tent on, every third corner. But I can't actually speak to any of those actual companies. I'm not quite sure what they're doing. But that might be city run.
Oh, good
In
point.
New
Yeah.
York City.
Yeah.
So I think that's very, and there's not a lot of drive-through anything in New York,
Yeah.
so the
Yeah,
city
right.
might be later in our in our built-out window.
Yeah, it's true. But
Yeah.
I think, the other thing too is that there are plenty of ways, you could still run this as an insurance model, right? You could still run this as an insurance model. And, that brings with it some other regulatory requirements and, some potential changes the way the business is structured, et cetera. What we've seen right now is that, the consumer data is showing that there isn't really a fear at the right demographic, at the right household income, for just paying out of pocket if they think somebody's sick. Right. It's very usual around the world for people to have to pay out of pocket if they're sick, and people deal with that all the time. So with deductibles on the rise across health insurance plans, and just, the right demographics, people are paying. When we, it's something, and maybe I'll leave it with this anecdote. When we first started 15toKnow back in the beginning, in the middle of 2020, we went to a bunch of big doctors' practices that we knew, and we said, give us $400,000. And in the middle of this pandemic, we'll get you, 10 times that over the next year. And they all said no. And they all said no because we said we weren't going to take insurance. It was going to be cash only. Because, how that changed the business was significant. They didn't agree with us. None of them invested. I can tell you, I invested less than $400,000 in the business originally. I've invested more since, and the business certainly paid me back and then some. And they're kicking themselves, and now some of those doctors are considering, investing this time because they're like, I never thought people would pay cash for COVID tests, and now they're even paying cash when they're available in Walgreens and CVS. So the market is changing, the landscape is changing. And I think Americans are just getting more used to having to put a little cash out of pocket for their healthcare anymore. And we think there's opportunity there.
Yeah, and the price point's so reasonable.
Correct.
Right. Yeah. What's the I have to make a comment. The bank debt that you gotten would suggest that there's a big vote of confidence, right? Because the banks just don't lend money, right? They look under the hood, they look for everything, right? So good for you. Yeah. I don't know how you did that, but that's pretty impressive.
Well, based on reputation, really, right? I mean, this is a bank that I work with quite a lot, and they've seen me be successful in other businesses. They've actually banked 15toKnow since the beginning, so they've seen the fat bank balances, that have come in, and they know that, I wouldn't be willing to put my reputation and my name on the line, and they saw this deck if that weren't the case. So, and I just want to say, like, I generally think debt is more appropriate in an operating business like this for some of this real estate build out than equity. I think it's a more efficient use of capital, because the debt payments are pretty low when you term it out over 5 years, which is where the bank is, even in a increasing interest rate environment. So.
Yeah. No, for sure. It totally makes sense. Well, this has been super helpful. Was there anything else you guys want to add before we wrap it up?
No, I mean, look forward to touching base with those on the call if there's additional questions or more detail that they want to dive into. Obviously ready and available to have those conversations, and really appreciate
Yep.
Appreciate Arthur, you getting everybody together, and appreciate everyone's time today.
Yep.
Yes.
And Allison, I just want to say, Charles, before I forgot, has asked for the deck.
Okay.
So, if anyone else is interested in seeing the deck, please, we've got the contact information. Allison will make contact, and we'd be happy to email that out. Okay.
Oh, wait, there was a question that just.
Yeah.
Who?
Why aren't you reinvesting the initial capital paid back instead of raising?
Yeah, and the answer is the initial capital, I've reinvested 350,000 of that capital. I'm signing personally for the 500,000 in debt. So we are reinvesting. Are we reinvesting to the level of where the business was? No, but to be perfectly frank, we can have a conversation with you in more depth. But the prior owners, because as I mentioned, I had the partner, Dr. Kapelusnik. Unfortunately, he's not an entrepreneur, he's a doctor. And so, he didn't really understand what it was going to take to get this business where it needed to go. So, we had to do with those profits what we did until, he was ready to exit the business, which he did about when Allison joined, and in April, and move on himself as we then push the business forward. And we'd be happy to explain in more detail how that looked and what that looked like if you're interested on a follow-up call.
Yeah, that totally makes sense.
And I just saw did you answer this one, Mike, about how long the leases are?
Oh, no, I didn't. So.
Oh.
Whoops.
Whoa. Oh, that was the question. So how long are the leases?
Magic.
Yeah.
Magic.
That's
yeah.
Really,
yeah. It depends. They're anywhere from 3 to 5 years, depending on there's one in particular we're looking at that's going to be a sublease from a bank that has 5 years left on it. So that'll be a 5-year lease. We will then be working with the landlord to look to extensions on that. But the other leases that we're looking at are about 3 to 3.5 years. But both of those have 2 3-year extensions attached to them. So while we're only signing up for 3 years, sort of at the front end, looking at 9 as the potential under the lease agreement that we could be in there, given the build out that we're going to need to do.
Yeah, totally makes sense. Well, this has been super helpful. Nicely done, guys.
Great. Thank you.
We'll make sure that everybody gets in touch and vice versa. Make sure that you have the information of the people on the call, and everybody on the call, feel free to connect directly. And if there's anybody you think that would be interested in what you've seen today, you're more than welcome to include them. And maybe we can do this again as things move along.
Awesome.
And super grateful for you guys. And Allison, thank you. It was so nice to.
Arthur, thank you. Good to see you after a few years.
And as again, we're going to put the recording up, so stand by for that. And as I always say, thank you for spending with us. The only thing you can't make more of, and that's your time. Thank you.
Absolutely. Thank you, everybody.
Take care, everyone.
Bye-bye.